Hello friends, welcome back to our channel. In the last video, we have discussed about diabetes mellitus from the causes to the complication. In today's video, we will discuss about management of diabetes mellitus. The main goal of diabetes mellitus management is to normalize insulin activity and blood glucose levels and to reduce the development of complications which are arising from diabetes mellitus. Although diabetes management has four components which are nutritional therapy, exercise regimen, monitoring of blood glucose levels and ketone bodies, and pharmacological therapy. Let's begin with nutritional therapy. The goal is to reduce 0.5 to 1 kg weight per week. To achieve this goal, we have to reduce 500 to 1000 kilocalories from the daily calories. About caloric distribution, first we see about carbohydrate. In carbohydrate food, we have to provide low glycemic index food such as barley, oats, brown rice, and white lean meats and dry fruits like that. Here, the question can be arrived what is glycemic index? The term glycemic index is used to describe how much a given food increases the blood glucose level compared with an equivalent amount of glucose. Next, fiber. Increased fiber intake in diet may improve the blood glucose levels and decrease the need for exogenous insulin, and also it will reduce the cholesterol level. This leads to decreased cardiovascular carbohydrate counting. It is a tool used to assess blood glucose management in a patient with type 1 and type 2 diabetes mellitus. Another tool is called carbohydrate budgeting. It means when a patient eat food which is packed in a cover, he have to read the label and know how much carbohydrate present in it. It is known as carbohydrate budgeting. Let's move on to the exercise. Exercise. It is an extremely important in diabetic management because it helps in lowering blood glucose level and reducing cardiovascular mortalities. And exercise lowers the blood glucose level by increasing uptake of glucose by body muscles and improving insulin utilization. Exercise like weightlifting can be done in patients with diabetes patients. A patient should do exercise for 30 minutes per day for 5 days or 1 week or 150 minutes per week. If a patient is on insulin and doing any prolonged exercise, he should take 15 grams of carbohydrate in between the exercise in order to prevent the hypoglycemia. Monitoring glucose levels and ketones. First, we talk about glucose monitoring. Self-monitoring of blood glucose. This allows for reduction and prevention of hypoglycemia and hyperglycemia and also plays an important role in normalizing blood glucose levels, which may help in reducing long-term diabetic complications like nephropathy, diabetic neuropathy, diabetic retinopathy, and candidates for self-monitoring of blood glucose. Patients who have unstable diabetes mellitus, like if patient having severe swings from high level to low level glucose within a day, or a patient with tendency to develop severe ketosis or hypoglycemia, like patient with type 1 diabetes mellitus, and hypoglycemia without warning symptoms, like patient who is on beta blockers. These are these are the indications for self-monitoring of blood glucose levels and frequency of self-monitoring of blood glucose. For patients who take insulin before each meal, I have to take blood glucose level to determine each doses. For patients who is on oral hypoglycemic drug, he have to take blood glucose levels 2 times a week and including two or postprandial test also. For all patients, testing is recommended when the patient is having hypoglycemia or hyperglycemia. Next, testing for glycosylated hemoglobin. Glycosylated hemoglobin means HbA1c assay. It is a measure of glucose control for past 3 months. When blood glucose levels are elevated, the glucose molecules will attach to the hemoglobin in the RBCs. This complex is a permanent and lasts for RBCs life approximately 120 days. The normal values typically ranges from 4% to the 6%, but in patients with diabetes mellitus, it is maintained at the range of 7% or less than 7% in order to prevent the hypoglycemia. Testing for ketones. Ketones are the byproducts of fat breakdown and they accumulate in our blood and urine, which may lead to ketosis and diabetic ketoacidosis. In order to prevent the diabetic ketoacidosis in patients with type 1 diabetes mellitus, we have to regularly assess the ketone body in the patient's blood and urine. Moving on to the pharmacological therapy, first we talk about insulin. Usually, type 1 diabetes patients should receive exogenous insulin for lifelong. In patients with type 2 diabetes mellitus, insulin may be necessary when he is on long-term basis or whose blood glucose level is not controlled even he is on oral hypoglycemic drug or doing any other lifestyle modifications. And types of insulins. Rapid acting insulin. It produces a more rapid effect that is shorter duration than the regular insulin. Because of rapid acting, patients should instructed to eat food within 5 to 10 minutes after injection. Because of shorter duration, this rapid acting insulin is given along with intermediate action insulin in order to maintain the basal insulin level. Examples are Lispro, aspartate, and glucose. Next, short acting insulin, also called as regular insulin. It is the only insulin that can be given in IV route. It usually given 15 minutes before food or either alone or in combination with intermediate acting insulin. Example, regular insulin. Next, intermediate insulin, also called as NPH, that means neutral protamine hedron or lenti insulin. Next, long acting or peakless or basal insulin. This is insulin. This insulin is absorbed slowly over 24 hours. So, this insulin is given once a day. This insulin is suspension with a pH of 4. So, it can't be mixed with any other insulins because this may cause precipitation. Methods of insulin delivery. First, insulin pens. Insulin pens are small, which contain 150 to 300 units of insulin, which are preloaded in the cartridge like pen holder, which uses a disposable needle. It is attached to the device and patient will inject the insulin like clicking the button in the pen holder, which is very convenient for patients who are traveling and need to take insulin at night. Next, jet injectors as an alternative to needle injections. It is very expensive and require thorough training and supervision when first time used. Next, insulin pumps. Continuous subcutaneous insulin infusion involves the use of small externally wound devices that closely mimic the functioning of the normal pancreas. When insulin pump is used, insulin is delivered by subcutaneous infusion at a basal rate. Example, 0.25 to 2 units per hour. Nursing alert. When administering insulin, it is very important to read the label carefully and to be sure that the correct type of insulin is given. It is also important to avoid mistaking Lentes insulin for Lenti insulin and vice versa. Complications of insulin therapy, which are localized redness, allergic reactions, swelling, tenderness, and insulin lipodystrophy. It means loss of subcutaneous fat at the insulin injection site. In order to prevent this, we have to change the insulin injection site for every 2 weeks. Then morning hyperglycemia. In this we will discuss about three phenomena which are insulin vanning, dawn phenomenon and Somyahi effect. In insulin warning, the progressive rise in blood glucose level from bedtime to morning. In order to prevent this, we have to increase the dose of insulin at the evening time, or if patient is on not on evening insulin level, we have to institute the newly evening insulin level. And dawn phenomenon, which means if the patient's blood glucose level is normal until 3 a.m. After that, the insulin levels will begins to rise. This is a compensatory a mechanism or natural changes from the growth hormone secretions, which which may increase the need for insulin level. To treat this, change the time of injection of evening intermediate acting insulin from dinner time to bedtime. And Somyahi effect. A normal or elevated blood glucose level at bedtime and decrease at 2 to 3 a.m. and the patient may be in hypoglycemic levels at the time and may subsequent rise in the blood glucose levels by counter regulatory hormones in the morning. In order to prevent this, we have to decrease the evening dose of intermediate acting insulin and increase some points about insulin. Insulin is given at 90-degree angle in the subcutaneous tissues. Best site for insulin injections. First one is anteroabdominal wall. Given at 2.5 cm or 1 inch away from the umbilicus and change the site for every 2 weeks in order to prevent the insulin lipodystrophy and anterolateral axpata form, which means deltoid muscles, and anterolateral axpata of thighs and buttocks. The absorption of insulin is higher in abdomen, then deltoid, then thighs, then buttocks. Insulin syringe, the gauge size for adult it is 27 to 29 with 0.5 centimeter or 5 millimeter long. For children or thin patients, it is 31 or 32 gauge with 8 millimeter long. The next pharmacological therapy is oral hypoglycemic agents. The oral hypoglycemic agents are used for patients with type 2 diabetes mellitus when their HbA1c level is greater than 8. Even he is doing lifestyle modification for 3 to 6 months. We see about Buchanan's group of drugs. In that group, we see about metformin. The mechanism of action of metformin is inhibit production of glucose by the liver. The side effects are lactic acidosis, hypoglycemia. The hypoglycemia risk will be increased if he is taking any other oral hypoglycemic agents or with insulin. And drug to drug interactions like NSAIDs, warfarin like the drug, and GA disturbance like nausea, vomiting. And these drugs are contraindicated in patients with impaired renal function because these drugs may cause kidney injury. So the patients have to reduce the dose or can't able to take this medication if patient have renal impairment. And another one important point is if patient is undergoing contrast or dye-induced study means he have to stop these drugs for 48 hours because this may precipitate acute kidney. The next group of drugs are sulfonylureas. In this we see about glipizide and glimepiride. The mechanism of action of these drugs are stimulate beta cells of the pancreas to secrete insulin and may improve the binding between the insulin and insulin receptors. The side effects of these drugs are hypoglycemia, mild GA symptoms like nausea, vomiting, and weight gain. If patient having cardiovascular risk means he should avoid these medications because these medications can cause weight gain. The next group of drug we are going to see is alpha glucosidase inhibitors, in which we see about agarbose. The mechanism of action of this group of drug is delay the absorption of complex carbohydrates in the intestine and it may slow the entry of glucose into the circulation, systemic circulation. The major side effect of this drug is hypoglycemia because this drug may slow the glucose entry into a systemic circulation. In order to prevent the hypoglycemia, you have to take this drug with first bite of the food or in between the two bites of the food. And GI side effects like abdominal distension, discomfort, and diarrhea, flatulence. Next group of drug we are going to see is glucagon linked peptide 1 receptor agonist. The example for this group of drug is semaglutide. If you are taking this drug in oral form means you have to take daily. If you are taking this drug in injection form means you have to take weekly once. The drug has biggest advantage like this drug will reduce the cardiovascular mortality by reducing weight. Last group of drug we are going to discuss about is sodium glucose co-transporter 2 inhibitors. The example for this group of drug is empagliflozin. It is used only in patients with type 2 diabetes mellitus because it improves the glycemic control in patients with type 2 diabetes mellitus. It promotes the urinary loss of sugar by inhibiting resorption of sodium and glucose in PCT of the kidney. The biggest advantage of this drug is reducing cardiovascular mortality by sodium loss. The side effect of this drug is if this drug may increase the urinary tract infection. That's all for today. If you like this video, share it with your friends and subscribe to our channel. Thank you for watching.